introduce Dr. Maria Mercadal. Thank you.
So first of all, thank you for letting me be here with you today, and also for letting me talk about children. We've talked a lot about adults. Professor Elena Cortez Pinto also introduced what to do with children, and I'm going to talk about this issue a bit more. So we all know the progression, and as we've been talking during all the morning, what we want to do is prevent this progression and also see in which patients there's more risk of this progression and we can work more with them. And as a pediatrician, of course, I think that children are this key point to not reach, to prevent the progression of the disease. So we're saying that NAFLD is one of the most common liver diseases in industrialized countries, and it's estimated to be the most frequent indication of liver transplant in the next decade. So all of what we want to do is prevent this, and children are the most important target, I think, in this matter, obviously because I'm a pediatrician. But how are we, big picture, obesity in children in Spain? This is data from 2015 of 11,000 children from 6 to 9 years. We're talking primary school here. Overweight up to 40% of those children, and obesity almost 20% of them. And what about NAFLD in these children? We have different data from all over Europe, but it ranges between 1.5 to 22% of all children, not just with, we're not talking only obesity and overweight children. Up until now, so strategies we've talked, weight loss, increased physical activity is what we're trying also to do with kids. And how are we doing it? I was asked to talk about what we do in our center, in our country. So what I have most near is 2 different programs that worked fairly well, and I wanted to present to you. One was Nens en Moviment. It's a multidisciplinary education program for the treatment of overweight and childhood obesity, and the targets were those: healthy lifestyle and eating habits. It was done in the hospital where I work between 1998 and 2012. These were the 2 people that started it, and it was a psychologist and a nutritionist. And they actually got that more than 80% of the patients reduced their BMI and percentage of body fat. They improved the quality of Mediterranean diet, increased fruit, vegetable, and everything exactly that they were looking for. These were obese children that were between 7 and 12-year-old, and it had books, interactive participation. It was an 11-week treatment, and what I want to point out is parents here. Parents were involved, and I think it's very important because, as Professor Elena Cortez Pinto was talking before about children and the taxes and protecting them with propaganda and so on, I think it's very important the paper of parents here. Because, okay, children would want more sugary food, more sugary beverages, and they at some point have money to get them. But for the first stages, and we are saying that there's a lot of obesity before the 10 years old, it's the parents that usually get these things for the kids. And they sometimes do it not knowing how much sugar there are in this food. I was talking to a group of parents of a friend of mine that asked me and an odontologist, and the kids were there and so on. And it was afternoon, and lots of them had, I don't know if you have it in your countries, it's like a beverage that's sold in all supermarkets, and it says it's your fruit you can drink. So basically these parents were astonished that I was saying that wasn't good for them, and also the odontologist, obviously. But they thought that was good, that they were actually giving fruit to the kids. So I think that obviously we can talk to kids and promote healthy eating and so on, but we can't take them out that they are in a home and that parents are very important to be educated in this. And another thing that I loved about this this study, this movement, was that they also addressed emotions. We all know that lots of us eat according to our emotions instead of if we are hungry or not. And by addressing this, level of anxiety and so on also improved in this study. Another study that I also like a lot is InfadiMed, because it's done for primary care carers, and it's addressed to kids very young, from 3 years onwards, and it's done through cartoons. Okay, these are the cartoons they use. And they've also had good results. And as we were talking about, what you teach to the kids at school goes back home. And they also, and in the patients that had this InfadiMed study, they increased consumption of fruit, vegetables, nuts, and decreased sweets and bakery. That is basically what we were looking for. And what difficulties do we find in children with NAFLD? Basically adherence, because this is very good. Nens and Moviment, after many years, they've seen that there's still up to 70% of the children that haven't got their weight back up again. But it is usually a problem because these programs, as I say, require time, require money, and even if you implement them for a year, 6 months, whatever, it does need much more, and that's where policies come in, and we don't have access to those, or just deciding upon them. The other, obviously, is financing. That was what I was talking about, and family involvement that I just said that I think is very important. We don't just work with the kid or with the adolescent, but also with their family, because one of the things that I see usually at the hospital is that maybe the kid is very interested in it, but the parent won't change. He still wants to drink Coke. He still wants to eat whatever, even if I'm saying that that's not good for their kids. And we've talked about changing lifestyle, we talk about parents, we talk about family, but what are we doing, like as pediatricians? So I think clinical trials in children, key points right now are looking for risk factors of disease progression that we were talking earlier by Professor Romero. Also histopathologic phenotypes, because in children they're different than in adults. And this takes me to the endpoints of our clinical trials, because sometimes we can't use the same as in adults. And obviously looking for non-invasive biomarkers. And I have to stress this point because it's really difficult to get parents to understand when you tell them that their kid needs a liver biopsy. So we do get a lot of throwback from there. And because of changes in lifestyle and what we've been talking about until now is difficult, and we all know about this, there has been a lot of work into trying to give treatment. Apart from this, what else can we get? Vitamin D. It seems like we all need vitamin D nowadays. But there are some studies saying that, as Elena Mestre was talking before, it doesn't mean that if you can be obese and not eating well, exactly, you're not eating well and you don't get the sufficient nutrients. And one of the studies done this year, and they were saying that the patients with overweight and obesity lacked vitamin D. Vitamin E is also been talked about, and if it's worth it to give it in patients that have NAFLD, also in pediatric patients. Probiotics, gut-liver axis, this has also been trialed. And also omega-3, you have 100 of different examples of studies done in this matter. And some of them seem to help. But usually in those stages that are not fibrotic patients. And probably in pediatrics, it's what we're more interested in, and to get them before and give them some extra help. Basically, very quickly, what do we do with our kids at our hospital? So sometimes the kids have obesity and so on, and in primary care they've done a blood test or they've done an ultrasound, and they send them directly to us, the hepatologists. But another time, it's the endocrinologists and nutritionists that send them to us. Kids that usually are over 8 years with BMI in kids, 3.5 standard deviation. We don't use the same numbers that in adults. And they already usually have an ultrasound and altered liver function tests. And I'm not going to talk about the protocol or all of it, but what I would like you to, or what I would like to talk next is about our project with our patients. Once we do everything that we know and you follow the guidelines and so on, you've done monitoring with them, we've sent them to the nutritionist, you've been with the patients and tried to improve the BMI and so on, and you don't get results, what can we offer them? So this is where our project started, and we got a grant from the Spanish Pediatric Association, and it was to evaluate if we gave omega-3 in these patients, would this help? Would this help in patients that are already receiving nutritional advice and our advice? And what we've done is a randomized double-blind study. We're just starting it with low dose and high dose of DHA, but also placebo. And I think this is the most interesting part because it's about, can we help extra? We know that health, lifestyle and health eating, it does work. Are we doing something else, giving them, or it's just by placebo saying, you know, we're giving you this and you're going to get better? Is that just enough? So it's me, basically, the study nurses and the nutritionist of one of them that's centered in this study. And we give 6-month treatment and then 6-month follow-up. And I hope to give you the results fairly soon.